Hi and welcome, my name is Julie. I'm going to deliver a presentation on human immunity. I will cover the first and second lines of defence, the third line of defence, self-recognition and tolerance to own tissues and rejection of transplanted organs, two specific immune system disorders, the categories of acquired immunity, the immune response to a vaccination including immunological memory, and the concept of herd immunity, vaccination programmes and factors affecting the vaccine uptake, and the benefits of vaccination. Infections. Immunity is protection against infections. An infection happens when the microorganisms that are not normally in the body, such as bacteria, viruses, parasites or fungi, enter the body. Bacteria are single-celled organisms that can cause illnesses such as UTIs, pneumonia, STIs and sepsis. Unlike bacteria, viruses need a host within the body to reproduce. Viruses cause diseases such as cold, flu, HIV, COVID-19. Parasites cause illnesses such as malaria, which is transmitted through a mosquito bite. Fungi causes diseases on the skin such as athlete's foot and ringworm, as well as the infections of the nervous system and lungs. Types of transmission. There are different types of transmission. Direct contact. This is the easiest way to catch an infection. If a person or animal is infectious and comes into contact with a non-infected person or animal. Indirect contact. This occurs when an infected person has touched a surface or object and you then touch the same place. Insect bites. When an insect is carrying a disease, bites such as mosquito carry malaria. Food contamination. Food or water can become contaminated and cause infection or disease. First line of defence. The body has three lines of defence. The first and second lines of defence are non-specific, which means they respond to all pathogens the same way regardless of their cause. The third line is specific. This means when the specific pathogens enter the body, it recognises them and coordinates attacks. When the pathogen enters again, the system remembers and produces a more powerful response. Firstly, I will talk about the first and second line of defence. The first line of defence is the physical and chemical barriers that stop the entry of pathogens. The skin is the largest organ of the body, which acts as a barrier to stop pathogens from entering the body. Microorganisms live all over the skin, and unless there is a break in the skin, they cannot enter the body. The skin is a part of the integumentary system and has three layers. The epidermis. This is the outer layer which provides a waterproof mechanical barrier. The dermis, this is the middle layer of the skin. It contains connective tissues, blood vessels, hair follicles, sweat and oil glands and nerve endings. The subcutaneous layer, this is the deepest layer of the skin. It is made up of fats, blood vessels, nerve cells and connective tissue. Fat is deposited and stored here. The stored fat helps protect the internal organs from hard impact falls and bangs, as well as helps to regulate the body's tissue, as can be seen here. Mucous membranes. Another first line of defence is mucous membranes. Mucous membranes can be found on the surfaces of your eyes, ears, nose, throat, mouth, sinuses, gastrointestinal tract, respiratory tract, urogenital tract and the vaginal tract. They stop pathogens, infectious agents and allergens from entering the body. As well as this, they also help keep the body healthy by allowing nutrients to pass through. There are many pathogens that can enter the body through the nose. Because of this, the nasal cavities are coated with a sticky mucus that traps microorganisms before they are able to reach the airways. If they pass into the airways have tiny ears known as cilia. These trap any particles that have entered and moves them to the back of the throat and swallowed, or to the front of the nose. These remaining particles can be removed by blowing the nose, sneezing or coughing, as can be seen in this image. The pathogens that have managed to pass the first line of defence activate the second line of defence. The second line of defence. If there is an infection or an injury to the skin, an inflammatory response will occur. The first response is increased blood flow to the infected area. The blood vessels expand and white blood cells leak from the vessels and invade the infected tissues. The white blood cells are known as phagocytes and they destroy the bacteria. During the inflammatory response, the area may become red, swollen and painful. When a pathogen has entered the body, the immune system may release chemicals causing a rise in body temperature, which produces a fever. When the body temperature increases, it can slow down or stop pathogens from growing. Complement proteins such as cytokines are small proteins that help in removing foreign particles. Pathogens and antigens. The third line of defence. Firstly, what are pathogens and antigens? Pathogens cause an immune response. When entering the body, they can cause disease and make a person very ill. There are four types of pathogens. Virus, these cause illnesses such as colds, flu and chickenpox. Bacteria causes illnesses such as pneumonia, UTIs and TB. Fungi causes illnesses such as ringworm and athlete's foot. Protozoa causes illnesses such as malaria. All are dangerous to the body, but viruses and bacteria are the most common. Antigens are molecules that can cause an immune response. They are the part of the pathogen that lets the body know it's under attack. These can be protein, carbohydrates, nucleic acid, and fat. Acquired immunity. This is not something you were born with, it is learnt over time from life experiences. When antigens enter the body, the immune system responds and remembers the specific antigen and the best way to attack. So when those specific antigens enter the body again, there is a quicker and more effective response. White blood cells are part of the immune system and help the body fight infection. White blood cells are not just one, there are 5 different types. Neutrophils. These are the most common type and make up around 50 to 80% of white blood cells. They are the first to respond to infection or injury. They kill bacteria, fungi, and foreign debris. They act by eating the cell, a process which is known as phagocytosis. Eosinophils. These respond to infections caused by parasites, cancer, or allergic reactions. They make up 0.5 to 1% of white blood cells but can become higher if suffering from allergies. They release toxins to kill the pathogens, which are mainly parasites and worms. Basophils. These are the rarest of the white blood cells. They are found in many tissues around the body. They help with allergic reactions by releasing histamine. They create antibodies called immunoglobulin and prevent blood from clotting. Lymphocytes. These are 2 types, B and T. B lymphocytes make antibodies and cells that remember the infection by a specific pathogen. T lymphocytes control immune responses and kill tumours. They are found in lymphatic tissues. Monocytes. These are the largest type of them all. They become macrophages, which then carry out the process of phagocytosis, and because of their size, they are able to digest large particles. Immunoglobulins. Immunoglobulin is also known as antibodies. It is made up of 4 chains and are arranged in a Y shape that is made up of 2 heavy and 2 light chains. There are different types of it. G is the most common. It can stimulate a direct attack on anything that it recognises as being dangerous or a risk to the body. It is the only antibody that can transfer across the placenta to a fetus to give a newborn baby some protection from some pathogens that it would not have been exposed to yet. A, this is the second most common. It plays an important role in the defence of mucous membranes, for example, inside the mouth. M, it consists of 5 monomers, and this is the first to appear to exposure to an antigen. E, this is the largest of them all, responds to allergic reactions and parasitic infections. And D, acts as an antigen receptor for B cells. Hypersensitivity. A hypersensitivity reaction occurs when the body produces an unnecessary and undesirable immune response following exposure to a certain antigen. This happens when the immune system identifies an antigen that is not a threat as a threat and attacks it. Hypersensitivity reactions are also known as allergies. There are 4 types of hypersensitivity. Type 1, this is an immediate response, a reaction mediated by the antibody E. This is a reaction to an allergy. Type 2, antibody mediated. This type causes cytotoxic reactions, which causes healthy cells to die as they respond to the antigens. The reaction is mediated by the antibodies G or M. This can be reaction to drugs. Type 3 is immune complex mediated. The reaction is mediated by immune complexes. Causes of this type can be some drugs or insect bites. The reaction leads to tissue damage. Type 4, reactions are cell mediated. T cells control this type of reaction. This type is different from the others as it causes a delayed reaction. Some causes of this is antibiotics and some metals. Self-recognition and tolerance. Self-recognition and tolerance is the ability of the immune system to recognise between self and non-self antigens so that only the non-self can be attacked. There are 2 factors that allow the immune system to identify itself and foreign bodies. This is through sets of cell surface proteins, major histocompatibility complexes 1 and 2, and human leukocyte antigens, also known as HLA. When the immune system comes across a new antigen, it is recognised as non-self by the innate immune system, and adaptive immune system will respond. When the immune system recognises antigens as self, it will not be attacked. Transplantation. Transplantation is a transfer of tissue, cells or organs from one person to another to replace a damaged organ with a healthy one from a donor. Depending on what is being transferred, the donor could be deceased or alive. This procedure is normally life-saving, and sometimes the immune system does not accept the transplant and sees it as a foreign body. It will then attack it and reject it because it sees it as a non-self. The donor and the person receiving the transplant will be carefully matched, and the recipient given immunosuppressive drugs which lower the immune system's response to try to prevent rejection. There are 3 types of rejection. Hyperacute, this rejection happens almost straight away within minutes after transplant, and acute, this rejection happens within the first few weeks to a few months. Chronic, this rejection happens within months to a few years. Autoimmune disorders. There are many types of autoimmune disorders. I have picked 2 to describe. I have chosen multiple sclerosis and type 1 diabetes. Type 1 diabetes is a long-term autoimmune disorder. It is caused by fault in the immune system response. The beta cells that produce insulin in the pancreas are destroyed by the immune system, which therefore stops the body from being able to regulate blood glucose levels because it cannot produce enough insulin. The symptoms of this are extreme thirst, tiredness, urinating more often, and unexplained weight loss, plus more. Multiple sclerosis is another autoimmune disorder. It is caused when the immune system attacks the healthy part of the brain or spinal cord of the nervous system by mistake. It attacks the myelin sheath and damages it. This is the layer that surrounds the nerves. Because of this, the messages that travel along the nerves are disrupted or slowed down, as can be seen here in this picture. The symptoms of this are vision problems, muscle spasms, stiffness and weakness, mobility issues, bladder and bowel problems, plus lots more. It is not known what the cause of autoimmune disorders is, but it is said that if a family member has one, you are more likely to have one too. Also, if you have one, you are more likely to develop another, and the reasons for this are still unclear. To diagnose an autoimmune disorder, the antibodies that are being produced need to be identified. This can be done by a blood test. Because autoimmune disorders attack more than one part of the body, it will be an inaccurate diagnosis for symptoms alone. There is no cure at the moment for these disorders, and the treatment is given to control the progress and to help with symptoms. Acquired immunity. Acquired immunity is the immunity that is developed over time. It comes from an infection or disease you may have had or vaccines or from someone or something. Acquired immunity can be either natural or artificial and have passive or active components. Let's start with active immunity. Active immunity is the most common type and is the immunity you develop from vaccines or an infection. There are 2 types, active natural immunity and active artificial immunity. Active natural immunity is antibodies that are made after having an infection. Active artificial immunity is when antibodies are made after having a vaccine. Passive immunity. Passive immunity is receiving antibodies from another person or through medication. Passive natural immunity is when the antibodies are passed from mother to baby by placenta or breast milk. Passive artificial immunity is when a person has been exposed to a pathogen and it is administered immunoglobulins. The difference between the two is that the active immunity lasts a lifetime but takes weeks to develop, whereas passive immunity is developed instantly but doesn't last very long. This can be a few weeks or to a few months. Immune response to vaccinations. Vaccinations are given with the intention of providing immunity against a specific pathogen. They expose the immune system to a harmless version of a pathogen, which makes the white blood cells produce antibodies to be able to fight it. There are different types of vaccines that come under 2 categories, live and inactivated vaccines. Live vaccines, these are made up of a weakened form of a pathogen and create a strong lasting immune response. Inactivated vaccines, these are not live and cannot cause disease or infection. They require more than 1 dose to be given, and the first dose acts as a primer for the second one. The 1 dose alone does not give immunity. The information is then stored in the immune system and is known as immunological memory. Immunological memory refers to the ability of the immune system to respond more rapidly and effectively to a pathogen that has been encountered previously. The primary response is when the person becomes infected with a pathogen for the first time and the body has to make the antibodies to fight it. This can take a few weeks and a person will feel the symptoms of the disease or infection. The secondary response is when a person is exposed to the same antigen again and the memory cells recognise it and act quickly by producing more antibodies to kill it before the person has any symptoms. Herd immunity. Contagious diseases are spread from person to person. Herd immunity occurs when the majority of the population develops immunity to a contagious disease. This can effectively stop the spread of the disease, as when the majority of the population is vaccinated against that disease, it is hard for the disease to spread and will quickly disappear. The most important part of having a vaccine is that it also gives protection to vulnerable people within the community, such as the elderly, newborns and immunosuppressed people who cannot be vaccinated. Contagion can easily pass freely from contagious to susceptible with no vaccine. When there are vaccines, contagion cannot freely pass to the susceptible through immunised, which can be seen on the image here. Although herd immunity works for many diseases. It does not work for all. Diseases that are caught from bacteria within the environment rather than a person with a disease will still catch you will still catch the disease even if you have been vaccinated against it. The population is growing as well as people travelling to different places a lot more now than years ago, which puts the chances of diseases spreading at a much higher risk and makes herd immunity more difficult to achieve. Prior to the introduction of measles vaccine in 1968, measles was a very common infection in the UK, with an annual notifications between 160,000 and 800,000, peaks every 2 years and around 100 deaths annually. Around 80% of the population developed measles in childhood. In England and Wales in 2019 there were 5 measles deaths, and since 2000 all reported deaths were of people who were unvaccinated. Because of vaccinations, the NHS has been able to save money each year, meaning that money can be spent in other areas where it is needed. Vaccines protect many people, yourself and the wider community, and it is better to prevent diseases from happening rather than curing them. Life expectancy has also risen since vaccines were started, which caused a reduction in diseases and deaths. Life expectancy in 1920 was 56 for a male and 59 for a female, but in 2019 it had increased to 79 for a male and 83 for females. There are many reasons why people choose to have or not to have a vaccine. Information and influences can have an impact. If a person was to receive information about a vaccine from a health professional, they are more likely to trust that it is safe and have it. However, if the information came from social media or the news, people may be less likely to have it. This is because there are so many mixed views and opinions, which can lead to incorrect information and cause confusion and anxiety. For example, the MMR vaccine in the UK in the early 2000s was in the news because it was said to have links of causing autism. This has since been proven not to be the case, but has caused a reduction in people allowing their children to have the vaccine. Possible side effects can cause a person not to have a vaccine or delay in having it, especially if they are generally very healthy. They may feel there is more risk to side effects than catching the disease. Religions, diets and personal values can have an effect on someone having a vaccine. It could be that the contents of the vaccine are against what you believe. Some believe that it is better to have natural immunity rather than artificial. Some people just follow the social norm and live in their area. Many people have the vaccine. They will follow, and same if the majority refuse, then they are more likely to not have it. A reduction in the uptake of vaccines will cause disease to come back. Benefits of having a vaccine. The benefits of having a vaccine for some people are to protect themselves or simply just to protect their family and friends. This is mainly because if they were to get the disease or pass it on, the effects could be devastating for either themselves or family. Whereas having the vaccine, they know they have that protection. A good example of this is the COVID-19 vaccine. Many people wanted the vaccine to have the protection because of fear of getting COVID, but some people who have no health issues, are generally very healthy and maybe younger, had the vaccine simply to protect their more vulnerable family members, friends and wider community. Antibiotics cannot cure a virus, and the way to control them is through immunisation. Because of vaccines, there has been the eradication of diseases, smallpox being one of them. Life expectancy has risen as people are becoming less ill, and vaccines give protection from serious complications from diseases. There are far less childhood deaths because children are vaccinated now from 8 weeks old. Cancer causes many deaths, and now there are vaccines to prevent some cancers, such as HPV vaccine, which protects you from cervical cancer, some mouth and throat cancers, and cancers of the genital and anal areas. That's the end of my presentation. Thank you for listening.